I'm Dr. Joni Winstead, and today we're going to talk a little bit about leaky gut syndrome. Well, what is leaky gut syndrome? Well, leaky gut syndrome is basically where our gut lining has been breached, whether it is transcellular through the cell or paracellular between the cells. When we have breaches in our barrier, it allows bacteria, it allows food particles, it allows things that should not leave our gut to get into our bloodstream. When that happens, it can create numerous problems in our body. Some of the signs and symptoms could be gas, bloating, diarrhea, seasonal allergies, chronic fatigue, fibromyalgia, skin conditions like eczema, acne, autoimmune disorders, rheumatoid arthritis, thyroiditis, Hashimoto's, Sjögren's. Numerous autoimmune conditions are diagnosed on a patient, and sometimes it's the leaky gut has triggered these things to be activated, basically. But what I'm interested in is, well, do you have it? Okay, and if you have it, why do you have it? So we're interested in some of the mechanisms of it. Some of that being diet, alcohol consumption, processed foods, excess sugar intake, eating fast foods, gluten, and casein proteins with a lot of patients create leaky gut or cause leaky gut. Medications, antibiotics, corticosteroids, antacids, overuse of all of those things can create leaky gut. You can have infections in your gut. You can have H. pylori, you can have a bacterial overgrowth, you can have a yeast overgrowth, parasitic infections. I find parasites in lots of people. You can have intestinal viruses, and some of these things that kind of go left undetected, basically. They can kind of go up under that radar and never be seen and cause leaky gut. Stress, cortisol. A lot of times in patients, we'll do an adrenal stress index. We'll see where your cortisol levels are, what's happening in your body in the stress level, and how you handle it, because that can create leaky gut. Hormones. When your hormones are out of balance, have leaky gut. Neurological issues, brain traumas, cause leaky gut. Strokes, neurodegeneration, all of those things lead to leaky gut. Metabolic issues, you can have intestinal inflammation. Once again, autoimmune conditions. Autoimmune conditions can cause leaky gut, or leaky gut can be part of the cause of the autoimmune conditions to be diagnosed. So there's a lot that goes into this. It's not just as simple as, oh, I have a leaky gut, let's fix it. We got to find out why you have a leaky gut. We've got to figure out what to do, what things we need to do to stop the why, because if we don't take care of the why, if we just repair the gut and you're still eating a horrible diet, you still have that undetected intestinal virus, your stress level is still out the roof, and your hormones are unbalanced, guess what? You're going to not fully repair your gut, and you're going to end up with a leaky gut again. Even though we do the process of things to repair it, you're going to have the problems again. So the way we do things, we found out why, we eliminate that, do the best we can with getting rid of the why, and we repair the gut, and we teach you how to eat and how to do things to make your life a little bit better, and we give you help you get relief from all those signs and symptoms of leaky gut. So if you're interested in my help or any more questions or information on leaky gut syndrome, please email me at askdrwinstead@gmail.com. Thank you.